knee comes in for a lot of bad press. You know, everybody says, I've got bad knees and I can't run because of my knees. And actually, what we really need to understand is the knee is just a joint in the middle of our legs, and it gets beaten up by other areas. So when we're working in clinic and trying to resolve knee issues, really, we tend to say it's not the knee's fault. A lot of the time, and in fact, most of the time, it's something else. So the key in curing knee problems is actually correcting the fault, correcting the cause. And that's something we're going to talk about more as we make our way through the webinar. So I think we're ready to get going now, guys. So we will get going. And as I say, with questions, with comments, feel free to drop them in as we go. So in this webinar, what we're going to cover this evening? Well, we're going to talk about the injuries of the knee. So this might include runner's knee. Again, probably one as runners that we might be familiar with this term, but perhaps not truly understand exactly what it is. And our more formal definition for it is ITB friction syndrome. We're going to talk about patella tendonitis, or sometimes can be bracketed as runner's knee as well, because it's so common for runners, but also we commonly term this jumper's knee. We're going to talk about meniscus or cartilage injuries. We're going to talk about ligament injuries, and we're going to focus on the MCL, LCL, ACL, and PCL. Now, if those letters don't mean anything to you at this stage, don't worry. We're going to talk about those. But some of you may be familiar with those terms and perhaps suffered those injuries. We're going to talk about hamstring tendinopathy. So this is the back of the knee pain. We're going to talk about calf tendinopathy. So again, the calf coming into the back of the knee and why that might cause us knee pain. We're going to talk about something called pes Anserine. Now, pes Anserine is a muscle attachment, which we're going to come on and talk to just below the knee, but can be a common problem for us runners. And finally, we're going to talk about arthritis as well. So let's get going. I think hopefully that's going to cover some of the things. There's multiple conditions of the knee, multiple things that we could talk about, but I wanted to pick out some of the key ones that I think are important. Now, what I want to do as I go through is to keep things as simple as possible for you guys. I think sometimes these things can be overcomplicated. So what I like to do with these webinars is to give you as much education as I can in a straightforward sense. So if you have any questions though, guys, as I say, drop them into the comments and I will come back to them. And if there's things you don't understand or things that are a bit confusing, I'd love for you to reach out and let me know about those so I can explain them in a more simple manner. But essentially, as I've alluded to, don't blame the knee. If you missed the start, I was saying that this knee receives all this bad press. I feel sorry for the knee. It's a joint that gets blamed for everything. But actually, it's a structure in the middle of our lower leg that gets beaten up and gets all this bad press. But what we need to understand is the bully. So as I always talk about when I'm talking about rehabbing knee injuries is, you know, if we had a child being bullied in the playground, what we could do is we could take that child out of the playground. And if we start treating your knee, that's what we're doing. We're taking the child out of the playground. But as soon as we put that child back into the playground, if we haven't corrected the bully, the problem's going to happen again. And this is exactly the same. If we stop ourselves running, the knee could settle down. But if we don't use that opportunity to correct the bullies, as soon as we go back into running, we're going to find that problem. So the real key of curing knee pain is to make sure that we are establishing the bully. So next, we're going to move on to talk about some of the injuries of the knee. Okay. So one thing, sorry, I did want to mention, just running a little bit slow for a second there, but just to fix the leak. Now, what I mean by this is to fix the leak properly. Again, another analogy I often give to people is if we have a leak at home, one thing we could do is just plug that leak. We could block that leak with something, but we all know that's not going to cure the problem. So if you're suffering with knee pain, you can stop running, or you can put ice on your knee, or you can try and treat the knee, but that will be a short-term fix. You have to correct the bully. So hopefully that point is clear as to what we're looking to do there. So the first thing we're going to talk about is runner's knee, ITB friction syndrome. Now, something you might have seen from me, guys, is that I did a whole webinar on runner's knee because it's such a in-depth and common topic that we went into much more detail than I'm going to today because we did a whole webinar on it. So if you want to see that webinar, that will be available on the running community page, the John W. Sports Injury page, or feel free to comment and I can ping you over that webinar. And we will be repeating that webinar, so keep your eyes out for that one because it is such an important topic. But what we're going to do is talk about it now. So So firstly, well, it's very, very common in runners. So again, if you talk through any running community, then they are things that, we might expect to hear about. Hence its name. It's one of those conditions that's given the name runner's knee when actually truly it's ITB friction syndrome. So where do we get this pain? Well, typically we get this pain on the outside of our knee, what we call the head of our fibula. So if you feel just below your kneecap, on the outside of your knee, you might start to feel a small bony lump, which is the top of the outside of your leg bone. Now, the ITB attaches into this bony lump, this head of the fibula. Now, so what happens is over time, and when we complete a consistent speed sport, so running being the sort of optimum one for that, is we create excessive force through this ITB that irritates that irritation, that head of that fibula. So it causes that pain. So yes, the ITB is the problem. But what we need to remember about the ITB is that it is just fascia. You can see there. Now, let me explain that point very quickly. Fascia is something that we have around all of our muscles in our body. It's connective tissue. It connects us all up. I often describe it like an onion. So we have an onion, which has the bulk of the onion. We have the skin around the outside of an onion, and we have that thin plastic layer in between. And that's what we have in our muscles, and we call this fascia. Now, the reason that I mention this is ITB is a big thick band of that fascia. So when we pulls at that outside of the knee, it causes pain. But we can't technically stretch it, and we can't really change the density of it or the structure of it. But what we can do is affect the muscles that pull on it. So that's the true getting to the cause of ITB. And most commonly, this is around our hip area or our glutes and our TFL muscle. So they are the important areas to be stretching. And I'm going to talk about curing knee injuries as we move through the webinar in a little bit more detail. But what I want to do is keep things very simple. Repetitive pain on the outside of the knee is very common in this runner's knee ITB friction syndrome. We don't tend to have it at the start of runs, but it tends to come on as we're running. And then once it's there, it will build and build and build, and you'll get this real stabbing pain in the outside of the knee. So the next one I wanted to move on to, because it's very closely linked to that, is patellar tendonitis. Now, we often call this jumper's knee, if you've heard that term. Now, the patellar tendon is the tendon that crosses the front of the knee. So if we look here, we've got the kneecap here and this tendon that goes over the top of the knee, and it comes down and attaches into this bony bit on your shin. So again, if you feel directly below your kneecap, you'll be on your shin bone. Slide down there and you'll feel a raised lump. It's what we call your tibial tuberosity, and that is where that patellar tendon attaches into. Now, the patellar tendon is the thing that joins our quad muscles to our shin bone. Now, when we're running, we use those quad muscles a lot. So what can tend to happen is if we get any dysfunction in those quad muscles, it can become very problematic or very sore for us. So it's a very common condition in running as a result. Now, pain is typically felt either below the kneecap or at the top of the kneecap. So again, you can see that the tendon starts here above the kneecap and it runs across and attaches into here. So typically people might say to me that they get pain running across the top of their kneecap or just below the kneecap or just above it. One of the common things I hear people say to me is stairs can be a problem. You know, yes, you get the pain when you're running, but even when you finish the run, walking up or in particular walking down the stairs is problematic. Or if you're getting a pain going across the top of the kneecap when you run downhill, that is very indicative of this patellar tendonitis. So, and the cause though is actually these quadricep muscles or something that's affecting those quadriceps muscles, because we use those a lot in running. So if we get dysfunction in those quad muscles, it creates excessive force at the tendon. It's a bit like the old song that we used to sing at school about the thigh bone connected to the knee bone and things. That's what's happening here. We've got these quad muscles attached to our shin bone, and what happens is they pull away at that structure if we get dysfunction. Now, I talk about this word dysfunction. Now, dysfunction can be caused by a lot of things. It can be lack of flexibility, lack of strength. They can be underactive, meaning that we don't use them well enough. They can be overactive, which means that we use them too much. Ultimately, this dysfunction can lead to what we call trigger points. And these trigger points are sore points in the muscle tissue that create excessive force on their structures. So if we get those trigger points, that's when we can get the pain at the kneecap, or what we term jumper's knee. So I mentioned this one, guys, about walking up or down the stairs can be a problem. Another thing we typically see is people say to me, when I knelt down, I felt this intense pain underneath my kneecap. So again, very, very common. Or people perhaps who are in job roles like electricians, plumbers, people that are perhaps kneeling down a lot of the time, can really irritate that tendon. It really highlights the problem there. So the next thing I wanted to talk about was meniscus injuries or cartilage injuries. So a good place to start with this one is, well, what is the meniscus? What is its role? What is its function? Well, they're discs of cartilage that sit in between our knees. So we can see these blue structures here. Now, these blue structures are effectively stopping these bones from rubbing together. If we didn't have those, that can cause a rubbing sensation on the knee, and that can really irritate the knee. They also act as a shock absorber. So when we plant our foot onto the floor and we get impact force up through the area, the meniscus is there to help to shock absorb. So again, when we're running and doing long distance running, unfortunately, we can suffer wear and tear, and it can lead to a tear in these meniscus. So as I said, there are shock absorbers and they prevent things from rubbing. But as I said, we can get tears in the meniscus. Now, how would you know it's a tear? Well, we have tests, manual tests that we can do. But one of the common symptoms that get described is things like locking or grinding in the knee. So if you've noticed a kind of grinding sensation or that your knee has locked, that can be very indicative of a cartilage injury. So yeah, it can require surgery. So a lot of the time people might be familiar with what we call meniscectomies or arthroscopies, which are where we go in and we normally via keyhole surgery nowadays can work into that meniscus. But it's not always the case. And actually there's a lot of research, and we've worked with a lot of clients who haven't gone down the surgical route and have got great results as a result of not doing that. So what I want to move on to now is talking about ligaments and the ligaments around the knee. So now, what are ligaments? Well, ligaments join bone to bone. So they give our knees structure. They hold them in place. Now, we have sort of four main ligaments of the knee, ACL and PCL. Now, the CLs in this stand for cruciate ligaments. So you might be familiar with this term. The cruciate ligaments are these cross ligaments across the back of the knee. So these ligaments here cross the back of the knee, if you can see those there, and they give the knee stability, and they prevent it from moving, the top leg bone from moving above, forwards and backwards, or what we call draw on the lower leg, and they get involved in rotation as well. So these can become damaged, not so typical in running in truth, but very common in sports like football, which involves a lot of twisting. We also have what we term the collateral ligaments. Now, the collateral ligaments are the ligaments on the side, and we have a medial collateral ligament and we have a lateral collateral ligament. Now, medial and lateral, medial just means the inside and lateral means the outside. So if you've had a ligament pain on the inside of your knee, that's likely to be a medial collateral ligament injury. So bearing in mind that ligaments give stability to the joint and give structure, if we damage those, and these are usually damaged by a twist or more of an acute injury, they don't quite so often tend to be these overuse injuries where we're doing something repetitively. That's much more likely to be a tendon issue. What tends to happen with a ligament is if we get our foot caught and we twist, it can create a ligament injury. Now, when we're rehabbing those, or if you're looking to come back from a ligament injury, because it gives the joint stability, it's very important to work on stabilizing exercises. So put simply, that might be balance work is something that you should be incorporating into your rehabilitation back from ligament injuries. Okay, so distal hamstring tendinopathies. And again, I've seen this question asked quite a lot of the time, which is pain in the back of the knee. So all of the conditions that I've spoken about so far, besides maybe the cruciate ligament injuries, tend to be sort of front of knee pain, which is more common. We do, from the running population, see more front of knee pain, or what we term anterior knee pain. But having said that, there can be very much back of knee pain, and this sometimes causes more confusion as to what it might be. We might be worried about certain structures of the knee, and a lot of the time it might be things that aren't actually related to the knee or part of the knee structure itself. So with our hamstrings, these are the muscles on the back of the leg. So these big group of muscles, we have 3 of them, and they come down and they form tendons on the back of the leg. One of the hamstring muscles actually wraps around to the front, which we'll talk about in a short while. But if we do have dysfunction in our hamstrings, we can get pain in the back of the knee. So the hamstring muscles, as I've mentioned, attach to the back of the knee. The dysfunction can result in pain in the back of the knee. So very similar to patellar tendonitis, the one we mentioned earlier, where you've got your quad muscles on the front getting dysfunction and pulling at their attachment point. And again, the way I often describe this to understand it is, if you imagine an elastic band was fixed to the wall and you continually pulled away at that elastic band and you pulled excessively hard, you might tear or damage that elastic band. And that elastic band would be likely to be damaged close to the point where it's fixed to the wall, because that's where it doesn't have that movement. It doesn't have that stretch to it. It's fixed. So that's where we get our damage. And this is what happens where we can have a problem, for example, in the belly of the hamstring muscle that creates this excessive force, but we get the pain in the back of the knee, what we call a distal hamstring. Distal just means lower, so a lower hamstring problem. And now the way that we might know if we've got one of these is, if you sort of found easier if you bend your leg slightly, but you've got these string-like structures on the back of your knee. I often describe them as like guitar strings, and they're your hamstring tendons. So if you're getting pain, swelling, inflammation in that area, it might well be a hamstring problem. And as I say, like when we talked about with the quadriceps, dysfunction could be caused by multiple things. So I'll mention them again, but the lack of flexibility, the lack of strength, underactive and overactive muscles. So it's really important that if you suffered any of these pains, that we get a true understanding of the cause. What's the problem? For example, people might come into me with hamstring tendinopathies, and we have a look at their hamstrings and they've got full flexibility. So we know that it's not a flexibility issue. So what I don't want them to do is spend all their rehab time doing stretching, because it wouldn't be beneficial. But it might be that they haven't got a suitable strength for the demands they're looking to place it in. So we'd be much better spending our time in strengthening work, if that makes sense. So that's why it's so important that we're truly understanding the cause. But when we have tendon injuries, with the first port of call is always really to look at the muscle of that tendon to see if there's any dysfunction in there. So how would this feel? As I said, it's on the back of the knee. It can often be very sore, in particular this back of the knee pain, and very sore to touch. So there's also a small muscle in the back of the knee that can become irritated as well. So just to give you a full picture, we term this the popliteal muscle. It's a very small muscle that crosses the back of the knee. So it's easy for that to become irritated as well, but it can be linked to the hamstrings. And it's really important. I've now spoken about quadriceps and hamstrings. I just want to mention one term, which is an antagonistic pair. Now, what that means is they need to work together. I sometimes describe it like a sibling relationship, is that they're doing different things, but they need to work in harmony for it to all come together. So we might find that people with patella tendonitis, so a problem with the quadriceps, but the quadriceps is actually doing okay. But what we found is that the hamstrings have no flexibility. So all of a sudden, the quadricep has to do all the work, and that causes the dysfunction. So when I said underactive and overactive, this is the relationship that can happen. So it's important that if we've got patellar tendon pain, we're not just looking at the quads, we might be looking at other areas as well. I hope that makes sense, guys, but I know it's getting a little bit more complicated. So if you do have any questions, please ask. Now, in the same light, what we can see here is that we've got these hamstring muscles here, which have the calf muscle also coming up to them, and they almost cross over those tendons. So like with the hamstrings, if we get a problem with our calves, we can get this pain in the back of the knee. Now, we probably know that calves can be problematic in running. I would be surprised if any runner out there hasn't had a little bit of calf tightness along the way. It's the first thing that has to absorb the impact up off the ground when we run. So it's got a real high likeliness of getting tight at times. Now, if that muscle becomes too tight, it can pull at its tendons. Now, we might be familiar with this with the Achilles tendon, for example. So you might be familiar with the fact that the Achilles tendon attaches into your heel, and that uses the calf muscle. So if you've got an Achilles problem, we want to address the calf. But it might well be the same for its other tendon. Remember, the calf muscle actually crosses two joints. So it has these two sets of tendon crossing two different joints. And so it might be that it's a calf problem that's causing us back of the knee pain. So it's another muscle that can certainly contribute to knee pain, particularly in the back of the knee. So as I say, very common to have this problem, but it can feel very similar to a hamstring tendinopathy. So sometimes it's hard to diagnose. We have people who come into clinic and say, actually, I've got this hamstring problem because I can feel it in the back of my knee. So I know it's coming from my hamstring. But when we give it some deeper investigation, we find that the hamstring's fine. But once we truly assess correctly the calf, we find out that the dysfunction's there. So it's important that we're addressing both when we're looking at back of knee pain. Now, pes Anserine, a fancy term, but what it actually means, it's a muscle attachment point for three muscles that share an attachment point. So as a result, because we have three muscles all coming into one area, it's very common that we can get pain here. Now, where is the pes Anserine? Well, it's below the inside of the knee. So again, if you feel your kneecap and you move just off to the inside and then slightly down, that's around your pes Anserine insertion. Now, the muscles that attach into here, we have the sartorius, the gracilis, and the semitendinosus. If you want to remember those, the way I learned it, or remember learning it all a long time ago now at university, was say grace before T, because it's the sartorius, the gracilis, and the tendinosus, or the semitendinosus, which is the hamstring muscle. So these three muscles all converge. So if you've got this sort of pain at the top of the shin towards the inside, that could well be, we might instinctively think towards shin splints, but it might well be that actually this is a Anserine insertion problem. Now, the key here is to really understand which of those three muscles might be problematic, or surrounding muscles that might be leading to dysfunction at the area. So I've mentioned, the three muscles, and these can irritate the area. So stuff. And now the final condition that I wanted to speak about, guys, was arthritis. Now, the reason I wanted to put this in there is, again, another one that gets so much bad press, and people often come into me and say, I've come to see you, but I don't think there's anything I can do because I've got arthritis. So it's kind of, I'm done. Well, I'm a big believer that it doesn't mean we have to be done. Bad news, guys, we all degenerate. Okay, and this is how I always talk about it. Unfortunately, the older we get, the more we degenerate. We're like any other kind of machinery. That's what happens. But actually, we can certainly slow the rate of degeneration. And as I spoke about in the Runner's Knee webinar, actual research is now finding that we can be delaying or actually preventing osteoarthritis by running. So don't think, oh, we're talking about arthritis, we shouldn't run because we're going to get arthritis. The research is actually showing opposite to that. But even if you have arthritis, one, you're not alone. Two, to a certain extent, I believe that everybody of a certain age who's perhaps had a sporting background will have some form of arthritis. But what we need to do is we need to manage this condition, because it is a condition that isn't going to go away. Okay, so put simply, arthritis is wear and tear. And the greatest physios in the world wouldn't be able to reverse the effects of arthritis. But what we certainly can do is prevent it from getting any worse and allow you to manage it. So, as I said, and what arthritis is where we might get damage to the articulating surfaces of the joint. So the bottom of the upper leg bone and the top of the lower leg bones, we can damage those surfaces, and that can cause almost like a crumbling or a flaking sensation, and that's the pain of arthritis. If you suffered arthritis, guys, it's typically worse when it's cold. So during the winter months, that's when our feelings of arthritis can become worse. But what we know about arthritis is that it can be managed whilst it can't be reversed. But what is absolutely vital if I'm working with somebody who's suffering with arthritis is that we make sure there's no excessive force, nothing more than there needs to be on that knee, so that we are protecting it. But also, movement is good. I talk about motion is lotion. It's the sort of cheesy phrase that I use. But the more we can be moving the knee in a good, well, sort of biomechanical way, then we are going to be actually helping to keep a fluid going to the knee, which will keep this motion is lotion going, and the knee will be well lubricated and prevent the pain associated with arthritis. So what we need to make sure is that there is no excessive force being placed upon that knee joint, and the knee joint is well protected. So you'll notice, guys, what I wanted to do is speak through the conditions and then talk about how we might remove this knee pain. From what you've probably seen, you'll know there is no one size fits all in terms of the recovery. And I know people might ask questions in the group, which is great. Always ask questions, because it's great to hear people's experiences, what's worked for them and what hasn't. But actually, in terms of treatment plans, it's quite important that we personalize those treatment plans where possible, because we might have the same condition, you or I, but actually it's being caused by different things. So we need to establish that cause, and we need to remove it in a way that's relevant for each of us. So we need to be very careful with just giving sort of carte blanche descriptions of how you cure every injury, because it's important that it's actually related to the person's problem and the cause. But having said that, what I wanted to do is try and give you some simple principles to follow. So there's multiple pathologies, and therefore it does require detailed assessment. Now, a quick plug for you guys, for the clinic here. We have a virtual clinic, so even if you can't pop in and see us face to face, our virtual clinics where we can join you online, and we have a discounted rate of just £22 for the session using the code Running Community. So just to mention that quickly, guys, but again, feel free to message me or ask me any questions about that if you want. I don't want to talk too much about that one. As I say, two people might have the same injury, but the cause is different. But we know we have these key principles that we want to apply. Now, what I've done, guys, is I've tried to build out a free ebook for you to give you as much advice as I can, to talk about the questions that I commonly get asked in clinic. You'll notice scrolling across the bottom of the page, a website, johnwsportsinjury.co.uk. uk/running. And this is a page that we've set up for runners, and there has this free interactive ebook. So I've tried to put content in there, I've tried to put videos in there, things that can be helping you. So I discuss the principles, I talk about some of the injuries that we've spoken about. So if you are interested by this, I'd encourage you, it's a completely free ebook. Head on over to that, and you can download that for free, and that will go through some of these principles that we're going to talk about. We also have a webinar all specifically around runner's knee, which we will be repeating at some point, but you can get that now by heading to johnwsportsinjury.co.uk/runner's knee. So number one, the key principle for you to follow is you have to understand really what your injury may be. Okay, so as you've seen, there's multiple pathologies, but I would treat a ligament pain in a completely different way to how I might treat a Anserine pain. But the truth is, the pain would be within probably about a 3-4 centimeter distance of each other. So it's important that we're not just saying, right, inside knee pain must be an MCL, I'll treat the MCL. What we want to try and do is truly understand what the injury may be. Now, I appreciate that might be intimidating for you because it might feel slightly complex. But again, in the book, I've put together some of the common running injuries that we've seen. And obviously this webinar, hopefully I've been able to explain to you and break some of those down. So it might give you some of the telltale symptoms to look for. Then what you want to do, first protocol that I'm working with people, is to assess the flexibility. So what we want to look at is the muscles that cross the knee joint. So you've got quads, hamstrings, some other muscles in there, like I've mentioned, like gracilis and things, calf muscles, and the muscles that affect it. So that might be the glutes and things. So you want to be able to assess those muscles for their flexibility. Are we placing excessive force on the knee joint? And any of these muscles could be creating excessive force. So what we want to do, you'll see I've mentioned the glutes there, which I often term the big bullies because they can cause a lot of problem down this kinetic chain. But again, in the book, sorry guys, going one step ahead there, we have this video on how you can assess your own flexibility and give yourself scores to then build on that. And that might highlight to you some of the structures or areas that are tight in you that may be leading to knee pain. Or other injuries for that matter. Next, what we want to do is be removing restrictions. So how do we do that? Well, this is achieved with appropriate stretching and myofascial release, which is a bit of a fancy term really, but in more layman's terms, that's a massage or rolling, where we're looking to remove any tightness in the tissue or any problematic tissue. So again, in the book, guys, I try to make this as simple as I can. There's content and videos about how I foam roll and use other things besides a foam roller for that matter, and the 7 stretches that I think to be most important for runners. Then once we've made sure that we're fully flexible and we have plenty of range at our joints, what we then want to be doing is strengthening. Okay, we need to make sure that the body is strong enough for the demands we want to place on it. So we need to make, the ultimate goal is to make the area strong enough before we come back into post-injury running. So it's the same with everything we do. Anything that we do in life, we need to make sure that our body is strong enough to meet these demands. So again, what I've looked to do is put a video together and some content where I've talked through some of the key exercises for running. Now, again, when we're working on personalized programs for people, we could be working from hundreds of different exercises, but I've tried to give you some general guidance, if I can, guys, that will help you out. So if you plan on increasing your mileage, so this might be starting running. This might be that you've only, ever had a small 1 mile trot around the block and you're looking to build on that. Or if you're actually an experienced runner, but you're looking to increase the amount of mileage you're doing, you need to make sure you are strong enough. So you need to take on a strengthening program to make sure that your body goes through the changes to be able to cope with the demands that you're about to place upon your body. So yeah, and that's everything from me, guys. So as I say, I hope that was helpful. What I wanted to do was give you as much content as I could around these knee injuries, give you a brief summary, because I know lots of us discuss all the different knee injuries. I wanted to try and summarize some of the key ones as much as possible, and then give you the general principles, which is to understand the injury, assess the flexibility and improve the flexibility, and then assess the strength and improve the strength. And that's the best way to be recovering from these knee injuries. But the overall message, if you can take one message away, what I would love you to appreciate is that the knee often isn't the problem. We need to look further afield through what we call the kinetic chain to fix that leak properly. So thank you for your time, whether you're joining us live or on a replay. I'm hugely grateful for the support that you provide to us. If you have dropped us a question, I will make sure I get back to those, and I look forward to speaking to you all soon.